Good afternoon. Thanks very much for coming. The reason for calling this press conference, for want of a better word, was some concerns generated in particularly Metro around the availability of emergency services. And I think there was a lot of concern on social media, certainly, and almost an air of panic, I think, at one stage. And what I wanted to do with this was originally to explain that, if you are anywhere in the province, dial 911 for medical assistance, help will come. I had intended to come in here with a shopping list of all the things we'd done for paramedicine and the ambulance service since I walked into the office in late December in 2015. But I've just come from a meeting with Mr. Earl and 4 paramedics, one of whom I used to work with in Central, Jane. And quite frankly, it was a really emotional meeting. It was very frank, difficult, but on the other hand, it was very informative from where I sat. And it certainly listed and identified a whole variety of problem areas that relate not just to Metro, but also to pre-hospital services, for want of a better word, outside of Metro and across the province. We as a government have done a lot. We've implemented a whole variety of recommendations, for example, from reports. We've invested money, these kind of things. But what I heard today clearly was there were still significant gaps, and they felt that much more in some areas needed to be done. Obviously, it was, as I say, an emotional meeting. What I have offered Mr. Earl and the paramedics particularly who came with him was that we would constitute very rapidly a group of senior civil servants in the department, senior administrators from the regional health authorities who actually operationalize ambulance delivery through RHAs, but also supervise and monitor the activity of private and community ambulances who also provide services across the province. I said it was important to me that we got this off the ground quickly and suggested that they could meet as early as next week if that would suit the paramedics, because some of these folk were from up on the Northern Peninsula and in Central and this kind of thing. Obviously, technology will help. We've certainly seen challenges in healthcare over the course of the last little while, some of which have been exacerbated by COVID, for sure. And this was really a pre-hospital paramedic kind of flavor to that. And I think I'd like to thank the paramedics particularly for taking time and sharing their feelings as well as the facts. And it was very obvious there was a lot of feeling from a group of people who were very dedicated. And it's shown that. I mean, you've only got to look back to Snowmageddon. You've got to look back through some of the weather challenges we've had. And indeed, when Larry arrived, there was a period where it was felt for everybody's safety that the ambulances should stay off the road. And I think there was a 45-minute gap there where that had to happen simply because of falling trees and power lines and this kind of thing. What I took from that meeting was there was a serious need for all of us to collaborate. We can't, any of us, fix this problem on our own. Big picture, the Health Accord has stated very clearly that with Dr. Parfrey and Sister Elizabeth's vision of the new healthcare system, a transformed healthcare system, that a hub and spoke model would rely heavily as an integral part on a high quality ground and air ambulance transportation system. But what we've got to do before we move to that is get to that. So what we need to do with this group, I would suggest, is that we need to craft some more solutions building on what we have already done that meet their needs over the next little while. Because quite frankly, when the accord comes in, there will be due process and it will take time to implement some of that. And we don't have, in their view, an awful lot of time. So I think Again, I just close now before I open it up for questions to reassure people of the province that should you need medical assistance through 911, help will come. I have offered that group to the paramedics, and they will let us know after they've had a little bit of time to reflect on whether or not they will accept that. So, again, thanking them for all they have done and all they do each day, I think I'll draw this part of the availability to a close, and I would suggest that media approach the mic individually, and I'm open for questions. Thank you.
Ministers, rather than approaching the mic, because
all right. Okay. You stay in your bubble. Stay in your bubble, Kelly.
wondering if you can go a little bit deeper into what this team would. You said senior civil servants. Can you give us a better indication of what exactly they would be doing and the timeline they would present for solutions?
Well, I think firstly, the paramedics, have to make the decision as to whether or not, and I really hope they do, want to meet. So we would envisage, Assistant Deputy Minister, Director of Ground and Air Ambulance Services, VPs from each of the RHAs, and whomever the paramedics want to bring to the table from their perspective. And the idea would be to figure out where the gaps are, because a lot of these are operational. They're not policy pieces as such. A lot of these are operational. Now, they did identify some policy pieces, and one of them was, for example, a delay in recognizing credentials of paramedics trained in other provinces. That's something within our department, because we took provincial medical oversight into the department last year. So that's something I can act on directly, and indeed we're doing that already. I think their phone calls are already underway. So it's up to them to identify what it is that they feel they really need immediately and short term, and then to look a bit longer term as to how this would feed into the Accord, because they are represented there at the Accord senior table by Mr. Earl, and that's part of the report, the health accord that will be delivered at the end of the year. So the two, it feeds into each other. So I don't know the details because a lot of them are operational. It's, do you have people on call or do you have them in-house working, staffing? How do you make sure leave is taken care of? How do you deal with people who have physical or psychological injuries at work? And there are mechanisms in each of the regional health authorities to deal with those, but what I heard clearly is that they don't always work the way they should.
I think one of the biggest things we've heard right now is that the offloading times is causing significant delays for ambulances to turn around and be able to answer the next call coming in. You had talked about a holding room. Yep. We're hearing from paramedics that's not working.
Well, and I think there is a holding room. It's got a capacity of up to 6. In addition to that, there's then what we call the buddy system, where one crew can stay behind and look after up to another 6 individuals, and the other rigs can be freed up. I don't know why it's not working, because on paper it should. This is where that group with the operational knowledge and the paramedics on the ground would be able to sit face to face with the regional health authorities, with staff from my department, and we can get to the bottom of why it's not working. Because I don't know sitting where I am. And it was very clear that there were gaps in the information that was coming through to the department and coming through to me. Difficult as it was to hear, it was important for me to identify that.
You just said that the group that's supposed to meet, should the paramedics be interested in that, is going to figure out problems to address. But we already heard at the NAPE press conference that there are identifiable problems, and that paramedics want more staff, more equipment, for example, better mental health support. And how far are you looking at changing something in these respects?
Maybe the group should be more solution focused, and maybe I misspoke, because that's really what we need here. I think you're right. They brought forth these problems. I mean, my information was we have a robust employee assistance program with mental health supports in-house for any health employee. But I heard from the paramedics that because of their particular stresses and the challenging situations they find themselves in, that doesn't always work for them, because the counsellors don't have the background with that kind of care, pre-hospital problems that paramedics have. So That's an operational issue, for example. We have doorways, we have Bridge the Gap, we have all those other halo of things wrapped around there for mental health support, and maybe that's an awareness piece. Certainly, a couple of years ago, we had a card for first responders to give them to say, I think it was Minister Parsons, who was then in Justice and Public Safety, brought forth this card for RNC, RCMP, and first responders and volunteer firefighters, who, if they felt they needed mental health, had their own line. But, I need to find out why that hasn't worked, for example. The staffing issues, we have addressed staff. We have put on another full 24/7 rig in Metro and a second 12-hour-a-day rig and staff. We have not completed, as far as I'm aware, through Eastern Health, the recruitment of those yet, so they're not quite there. We have arrangements with Eastern Health now to try and take out of the acute ambulance system those elective transfers where, being a tertiary care centre, you'd have to send a patient back, say, to Placentia or to Gander by transportation. So that's not taking away from those people who would be available to answer 911. We have pilot schemes in Western and Central, and I think they're just kicking off one in-house in Eastern. So it's kind of a different flavour, but I've already heard positive reports about that. So it reduces the number of calls that go to the frontline ambulance over the course of a year by maybe 3,000. So that's not insignificant.
Minister, you mentioned gaps that were preventing you from getting the accurate information or the full picture. Where are those gaps?
That's one of the things that this group will come back and tell me, should it get constituted. I think sitting in the office in any ministerial department, you rely on, in my case, agencies, boards and commissions to supply you with information. As information is aggregated, it's like statistics. You get the numbers, you get the percentages, but it doesn't tell you the story behind the 2% who have a problem. It simply identifies them. So that's part of it. And this, in a sense, today, difficult as it was kind of a reality, a kind of ground truthing check, where you actually had paramedics in front of you telling you what their challenges had been 2 weeks ago or a month ago or some major event in their professional life that they were concerned about. And you don't get that unfiltered from the reports. You can't really from regional health authorities.
So you should have probably had this meeting earlier. I mean, if you had this one-on-one, face-to-face sort of thing, what made this morning so different to strike this?
I think, to be perfectly honest and to be perfectly fair, the original communication that we had from NAPE around this arrived in the middle of that difficult period where we were trying to come out of yet another wave of COVID. The people who are managing this file and these files, like with pretty well any other topic in health, have spent a large proportion of their time managing COVID. We have, like others, tried to redeploy resources to support the COVID initiative, but they've had to come from somewhere at short notice. And I explained that to Mr. Earl, and I don't think he was entirely unsympathetic to that. I think his bigger problem was the frustration and emotion from his members, which he had to and did very well at representing.
Minister, why seems like it always takes to come to a point like this where it had to be an emotional outburst, emotional meeting to make changes. And you said yourself there that sometimes policies on paper that should work or strategies that should work don't always work in operational or real ways. How can we get there earlier, and so don't have to come to a meeting like this where people are.
And that's a very good question. And what we found with other unions and advocacy groups is regular meetings with the right people, so there are lines of communication open, so that the Department of Health doesn't become a silo separate from the ABCs and separate from the patients of Newfoundland and Labrador. So that's been the big learning lately. And in actual fact, COVID has kind of made that easier. We could get this meeting together at short notice. It was only really organized on Monday or Tuesday, whenever the letter from Mr. Earl and his paramedics arrived. And we could get people from, Roddington or the Northern Peninsula, wherever that gentleman came from. He was certainly up in that neck of the woods because he worked for Labrador Grenfell for a year before I left it. And we could get them together very quickly. They could just simply dial in and zoom in and literally face to face. It's very effective.
One of the things that we've heard from Nathan from the paramedics is that red alerts are becoming increasingly consistent with them, and they're looking for those alerts to be made public. Is that something the department is looking into doing or willing to do, so the public is aware of when the system is in red alert, that an ambulance may take longer than average to get to them?
We had a discussion about that, and maybe again it's a communications piece, but what we have undertaken is to try and standardize our reporting across all of the RHAs. Eastern Health is the only one that's got a full implementation of CAD, computer-aided dispatch. There are pockets of this in others. But the gold standard now for pre-hospital care is response times. How long does it take to get an ambulance to the side of the patient, be it in a kitchen or a ditch somewhere? And those are what we're going to measure. And certainly I think a public reporting mechanism would fit with my other philosophy, which is to put this stuff on a portal from health and community services about wait times in emergency departments, wait times for lab tests, this kind of stuff. Nova Scotia's kind of led the way, and prior to COVID, we were looking at introducing portals like that. And this would be another metric that we would put up there.
You believe paramedics have said it, that they're in critical care mode. Is that what you heard today?
They regard themselves as beyond a crisis. Those are the words they used to me. There is no doubt that they, like other care providers across healthcare, have found this last 18 months, and certainly this last 6 months in particular, very challenging. We're seeing huge changes across the labour market in general, and health, nursing, paramedicine are no different. And we need, as a government, across government, to adapt to that. And it's been challenging. It is challenging.
Do you see it as a crisis?
I think they have problems. I don't like being made to use words that people want to put in my mouth, because then that becomes the sound clip. And then, the next crew come along and say, well, you said that was a crisis, but what about us? There are challenges across healthcare. Healthcare will never be fixed. It always has to be managed. And that's why you need a Department of Health. And that's why, unfortunately or fortunately, you need a Minister of Health.
What can be done in the immediate term? A group is a team, set up meetings, that sort of thing. They'll find out things over time. But, they're on the road now. They'll be there tomorrow, tonight. So, what can be done? Did you give anything to placate them in the very, very short term?
That was the question that I asked them. And they had a variety of suggestions, some of which are actually really quite easy. There was some issue about counsellors, for example, with EAP. That could be fixed with a phone call to the RHAs. There were some issues about provincial medical oversight and doing the licensing piece for people coming in from Ontario or Alberta who want to come and work here. I can get that fixed, and we can start working on that tomorrow morning. So some of the other things, I can't knit a paramedic. It takes 18 months to train a PCP. We've doubled the number of PCPs in this province since 2016. We've introduced advanced care paramedics who will add a huge level of care and triage, and even the ability under certain circumstances to go to a house, treat somebody and leave them at home so they don't have to go to the emergency department. So we're building on that. We're aware of some of the things we need to do. The message we got from paramedics who spoke to me today was that this may not be fast enough or far enough. And, I've had discussions with the Minister of Education about increasing seats in CNA for PCPs, for primary care paramedics. That's in his remit, that's in his district. One of the challenges we've got is if you look at the healthcare facilities for training, that's the place that trains PCPs, ACPs, RNs, nurse practitioners, medical clinical clerks from the university, and residents, as well as a whole variety of other groups such as PCAs. There comes a point where you have to think about bringing training has to be outsourced, in the sense that people go to to other places. And we provide bursaries for that. They identified an issue with the bursary program as far as paramedics are concerned. I don't have a problem with fixing that. It's almost a typo. So again, that's another immediate thing we can do. So it's a tangly web of trying to unravel it, but I'm committed to do that, and these folks certainly made their case very strongly.
You just spoke of the training at CNA, but then at the same time we hear of all these problems that the paramedics are bringing up. How are you planning on making this profession kind of attractive for future generations so that we don't run into more problems by having less and less paramedics?
I think that's a good question. It certainly speaks to some of the other things that were brought up, which is about retention. And I think really the retention piece I heard today was around working conditions and the stresses they find themselves under. Those are operational issues really for regional health authorities. I need to get a little bit more granular detail about what those might be because they were very general, they were very forcefully presented and very emotionally presented. But that's what this group can do that as a policymaker, I shouldn't be involved in operational activities, but I need to make sure someone is and someone's addressing them. So, that's the offer. Come to the table and we can get started as soon as next week if the folk are available to do it. Certainly from my point of view, they will be. 23 of the 27 have been implemented. One of them involved a new depot for ambulances, but we've moved away from those to what's called dynamic dispatching. So that's really redundant. So the short answer is we've gone a long way there, but that hasn't of itself fixed the problem either. So again, what are the gaps? What is it more that is needed that would make the paramedics we have less stressed and so on and so forth. So POMAX is 6 years old now, but 23 out of the 27 were implemented.
You also mentioned all the mental health services that are already available to paramedics, and yet they keep bringing up that they want more support. Why do you think the services that are already in place aren't working for them?
Somebody needs to talk to them to find out. I mean, we had an hour and 15, hour and 20 minutes with 4 paramedics. And really and honestly, those are challenges for our mental health and addictions group here as a policy piece. They are not the only first responders who find themselves in that situation. We have RNC, we have RCMP, we have volunteer fire departments. And so they may have challenges in common with mental health support, and paramedics obviously would have challenges in particular. So we can look at that, but you don't get the answers out of a single meeting. And I offered them a further meeting because I realized that we kind of ran out of time even at an hour and 20 odd minutes. So I would be delighted if they would come back. And as I say, I can't fix this problem unilaterally. The regional health authorities can't fix this problem by themselves. The paramedics can't fix this problem by themselves. We need to be at the same table collaborating, because at the end of the day, we all want the same thing, which is the best care for the people of the province. Okay, seeing no more takers, thank you very much for your time. Appreciate your interest.